Okay, I'm going to do a general posterior neck release, but the focus is going to be splenius capitis, which is really deep. Let's say deep neck muscle in there. So first, just apply some lotion up the cervical area. Start with thumb pressure at the base of the occiput. Hold their head, let your head relax where you need, and just let the head kind of drop down as you give some pressure into that deep neck tissue. But make sure you stay close to the vertebrae, but not on the vertebrae, okay? And then I'm gonna glide just lateral and keep following that line, lateral, all the way so you clear the entire side of those posterior superficial neck muscles. Do the other side as well, okay? After you've released that, from there what we're gonna do is we're gonna try to get to that splenius capitis and cervicus. The trapezius is right here, okay? Let your head relax for me, okay? Scalenes is here, okay? We wanna be between those two tissues. And now I have to use my thumb here. So I'm gonna go between those tissues, and this is the important part. Let the head relax, Edie, there you go. I'm gonna apply pressure in at like a 45-degree angle here. You're not gonna be able to see this when I do this, but I'm gonna tilt the head towards me, and I'm applying that pressure in that vector, okay? Hold the pressure. You'll feel some restriction in there. Just kind of hold. You might only have maybe an inch of space as you get in there. So you're pushing as low as you can, and I'm coming back up with pressure. Okay, so let's show you that again. It's right here, okay? As I rotate in, the pressure stays down at a 45-degree. Both sides, do the same thing. So that gets the posterior tissue. Here's the SCM. You can see this sternocleidomastoid muscle, and here's the scalene. So remember, between those two tissues is what your goal is, okay? You might want to release this scalenes first, okay? I would start with a little bit of pressure under the clavicle, okay? So let me straighten this out so you can see this a little better. So under the clavicle, and put the pressure in and down slightly, and just kind of hold. You'll follow this all the way up toward the midline of the clavicle. Some people, it's difficult to even get underneath that clavicle because it's stuck and tight here. Just follow all the way up, turn the head in towards the area, and you'll release and relax that tissue a little better. From here, follow with your 2 fingers, 3 fingers up under the SCM, okay? And you're still going for that scalene attachment at the cervical region, okay? So gentle pressure here, nothing too hard and just real gentle. You'll feel the tissue touch your fingertips. So maybe a 2-3 pressure out of 10, and just kind of hold some spots. Don't do any cross fibering there, it can irritate. Okay, after you've done that, you can come in and also release the SCM here, okay? So you start up by the ear, the mastoid attachment here, compress that. After that, you can come down and hit the other 2 heads and compress those. So the sternal head is here, okay? You can see it just compressing that. And the clavicular head of the SCM is right next to that, right there. Okay, usually with that, I will just put my fingers in there if I can't compress it. After that, go through an entire tissue and just kind of hold sections, maybe 1 to 2 inches apart. So you just compress all the way down, maybe hold for 10 seconds max. This can be really sensitive, so make sure that you take it really slow and really communicate with your patient. So we're compressing, okay? Just so you can see this, I'm turning my hand in a different direction. Normally I'd be covering it. And after that, you'll come back to your original spot here and kind of make the money sign, or kind of going with the fibers down along that SCM. So there's a general posterior neck release and some really general anterior neck release. Thanks for watching.